Welcome to a very special episode of Inside Medical Malpractice, and thank you so much for being here once again. I'm excited to introduce today's guest, Dr. Laura Fortner. Dr. Laura is a board-certified OBGYN and certified life coach. She's been practicing for 21 years in medicine and went from private practice to now being an OB hospitalist physician part-time. Part of the story behind this is that several years ago, Dr. Laura was hit with a malpractice suit. It started in 2013, and it's still not over. During this event and all the things that went along with it, Dr. Laura struggled with shame and loneliness and anger and doubt and fear, feelings of helplessness, like many people do who are going through litigation. And she decided to get some help. She sought out the assistance of a life coach, which showed her how to find her way back to what she describes back to herself and back to her power. And it helped her come to peace with the outcome of the lawsuit, however that happens to turn out. After fighting her way through this difficult process, Dr. Laura said she woke up one day knowing that she needed to help other physicians going through the same thing. She believes that us healthcare professionals mix up who we are with what we do, and I can attest personally that that is very true. The name nurse and the name doctor becomes very, very much who you are and what you do and how you are approached by people outside of the workplace all the time. And she also believes that the personal and moral injury that occurs after a lawsuit can be devastating. I know, and I've talked about this before, that medical malpractice being sued I know personally has taken a lot of bright, shiny nurses out of their career, or led them to downgrade their practice to a less risky area of medicine. She started something called the Med-Mal Coach, and we'll talk about that during the course of the podcast today. But through this, she hopes to walk physicians through the stories that may be holding them back, to learn to separate facts from opinions, learn how to process the very difficult emotions that go along with litigation, and return to their more self-assured and confident self. Welcome, Dr. Laura. I am so very pleased that you're here with us today.
Thank you so much. I'm really honored to be a part of this podcast and excited to be here to talk about this important topic that never really gets much press or, no one's really talking about it.
Well, I'm excited to have you too, because as we discussed briefly, this has been a small passion of mine. And I have to say that investigating the effect of stress, litigation stress on nurses was probably the start of my entire career as a legal nurse consultant and all of the education that I do now. Because my little tiny bit of research in 2001, just with 12 nurses and knowing what I'd been through myself as a longtime labor and delivery nurse, it just really highlighted that being sued is comparable to many other huge life events, like the death of a spouse, a loss of a child, a divorce, a move to another city. It's a really tough thing. And I'm with you. When I was looking for research, there wasn't a lot, and there wasn't a lot of support or help, and certainly not by people who, like you, really truly understand the effect. You're not just a therapist or counselor, not belittling therapists or counselors, but there is nobody like somebody who's been through an experience to know how to help you through it. So I'm so proud of what you're doing and the fact that you've taken a very, very painful experience and now turning it into a business and a support group for other people going through the same thing. So let's just start with that. I'm in awe of you, and I think it's great what you're doing. So I'm so happy to have you here.
Gosh, thank you. It's been a long road. And what I like to say is I've figured out how to turn such a deep emotional pain into a purpose. And that's what you did, so many years ago. And for me, this started on my journey in 2013. It's still ongoing. It hasn't resolved yet. And I really went on a self-healing journey to heal myself, to be able to sleep at night, to stop worrying, to be able to have that peace of mind, and honestly, to be that confident, assured physician again. And I think what happens is physicians aren't prepared for this kind of thing. There's no training. We get some training in risk management, how to avoid litigation. but we don't get any sort of training on how to get through something like this. And it is a major life event, like you said. It's one of those things where, it's traumatizing, really. And the emotional injury is really the biggest cost to litigation. And the emotional injury of the physician, of the nurse, of the healthcare provider goes on because these cases, statistically, the average time these cases take to get resolution is 4.7 years, not months.
Right.
Yeah.
And obstetrical cases can take much, much longer. I've done a lot of speaking to nurses. Before COVID hit, I had 21 engagements across the country that would have anywhere from 2 to 3 to 500 nurses in them. And without a doubt, at every single one of those conferences, there'd be a nurse who would come up and speak to me afterwards and have lots of tears and a very, very detailed story and memory of some event that had happened in their career, usually OB nurses, because those cases in particular, as you know, go on forever, or, until the child reaches the age of majority, and then sometimes years beyond that. And the memory was still so sharp and the pain was still so deep. 30 years later, quite often, and it often starts on the day of the event and lasts well after the litigation is over. So anyway, let's start today by talking about your story. Let's hear what happened. Share with us as much as you can about the lawsuit, how it went and how it's going, and what happens next in it, and your journey through the legal system.
Yeah. So, of course, when this happens, the first thing that happens is you do get served papers, and by either the sheriff or, some sort of officer. And the funny thing is I really think sometimes there's a ploy in when this happens. I mean, the first time I was served, I was in my office, and of course everybody was there, and it was right in front of the entire staff. And then it got dismissed. And then the second time was in my home a few days after the holidays, where my kids were with me, and I answered the door and the officer handed me papers. And that one event, you say that, these nurses come up to you and can detail the trauma and the emotional turmoil they've been in, no matter if it's already over. That one event, just getting served, is very traumatic in itself. And I remember that day like it were yesterday, and how little my kids were. And I had to get them all sort of in an order. And then I closed my bedroom door and I just sobbed. And I can bring that emotion right back to me, because that's how significant the pain and the emotion is with these kind of things. And that doesn't go away, unfortunately, that emotion, that attachment there, because as the case proceeded, it did end up going to trial, and trial in itself is a whole other traumatic experience. And so all those things along the way just cut at who we know we are. And this is where, when I talk about physicians, especially, and even nurses, I think too, the healthcare worker in general mixes up who we are with what we do. There's no sort of like boundary there. And so this is a deep personal attack. And oftentimes with these cases, and even mine, even when we believe no medical negligence was done, and there was, it just was an unfortunate outcome, and we did everything by the standard of care, it still doesn't take away the doubt and the negative thoughts, the intrusive thoughts about maybe we're not cut out for this. Maybe this is not for us. Maybe we are not as good as we thought we were. Even when there was no medical negligence, these are the things that we still think about. And these are the stories we tell ourselves after these events. And so I went through all of these events and still had this story playing that, I wasn't a very good doctor. I must not be. Although I had evidence all around me, Chris, of all of the thousands of deliveries I've done and thousands of patients that have thanked me and wrote me notes and sent me pictures. And even though all that stuff is still coming in, I'm not looking at it. And I'm just looking at this situation and the trauma that it has in me. And so it is still ongoing. And while I can't really talk about the details of what's happening with that, I do want to point out, because it's so taboo to talk about in our profession, I really want to point out today and help the listeners understand what we can talk about. Because when this happens and we get served papers and we go through litigation, we are told by our lawyers not to talk about this. And really what they mean is don't talk about the details of the case. They should also say, but you can talk about this with the emotions that you're going through, and you will have emotional turmoil. You will have stress. You will have what's called litigation stress. And we can talk more about that. And you want to reach out for some help. And you want support. You need support through this. So I think that educating healthcare workers that they can still get help and still talk about what they're going through is so important right now, especially if somebody's going through it currently. Because for me, this is ongoing now 9 years for me. And I will tell you, the first 6 to 7 years, every time I got an email, every time I got a confidential letter sitting on my desk that was sealed, I started to get heart racing, nausea, palpitations, didn't want to open it. The triggers of that emotional pain all come back to you, and it affects everything you do. And when I went on my self-healing journey to heal myself and get that peace of mind, that continued for years.
Wow. Well, I'm so sorry that you've gone through this and are going through this, but I'm so, so grateful that you're talking about it as publicly as you are, because I think your story is not unique. It affects different people in different ways, but I've never talked to anybody that's got any healthcare professional that's gone through litigation that hasn't had some version of your feelings and your story. And like I said, sometimes it really takes people right out of healthcare or causes them to go into a different level of profession that they've been practicing. And you, of course, as an OBGYN, are in one of the hot spots. And statistically, I think, well, what are the odds that an OBGYN will be sued in their career? I think they're pretty high.
Yeah, let's talk about the stats, because there is some literature out there on the statistics of this. So if you're in a high risk field, which is surgical field, OBGYN is in this category, ER is even in this category, 99% of us will get sued by the age of 65 if we practice until then.
Yeah.
And I believe it's 88% by the age of 45. And
Yeah.
if you're in a low risk specialty, so pediatrics, family practice, sort of the primary carers, your chance of getting sued by the age of 65 is 75%.
Yeah.
So it's unlikely not to be sued.
Yeah, that's true. Many lawyers that I talk to say you're not even a real doctor till you've been sued. And it's kind of interesting too. I've talked to lawyers about litigation stress in healthcare professionals before. And sometimes, like, to them, it's just their job. They're just doing what they do. And thank goodness they do it, and they do it really well. But, I'll say that this is really difficult. And I sometimes get this really stunned look like, why? Why is this so hard? Like, well, because it is. Because I think exactly the point you made. This is so much our identity, who we are and what we do inside and outside the hospital and inside and outside of whatever our professional practice is. So, I think your lawyer is not always the best person to offer you this kind of emotional support to get you through this, because they don't have the same view of what litigation is. To them, it's their day-to-day work, and so is the courtroom, and so is everything that goes along with it. So it's really important, I think, to note. So those stats that you just quoted, are those U.S., because I'm in Canada, as we know, we're not going to focus too much on that, and you're in the U.S. Are those U.S. stats? Because
Good question. I can put the article somewhere where people can easily find it. I do probably believe that is a US article. But I would think, honestly, I could imagine, especially in high risk specialties, that it's very similar in where you are for sure. And just to kind of point out something that you said about, lawyers and this is their job. And so they don't take it as personally. There are other professions like accounting and insurance companies and insurance people. They're all getting sued too for malpractice, but they don't have the same emotional injury that we do. And it is because I think what we sacrifice so much of our lives to go into the field, and we give up first steps, field trips, times with our kids and our family for others and our patients. And that's who we are. And I think that all wrapped up is some of the reason why it so deeply affects us.
Well, I think another part of that to add on is that I don't know of another profession where the outcome can include serious injury or death of another person, right? I mean, there's terrible outcomes in other industries without a doubt, but they're not quite so close to home as injury and death of another person. And that's a tough pill to swallow, in anybody's book. That's really tough. So talk a little bit more. I'm sure that there were some very, very difficult times to this, but talk to us about I'm a believer that there's something to be learned in every good and bad and terrible situation. And life is hard. Life is hard for all of us. What are the most valuable things that you learned from this experience?
Yeah, I think, first of all, I think if you would have asked me this question 5 years ago, I would have said, I don't even know where to look. Like, I wouldn't have seen any upside to it, but I wouldn't be the person that I am today. I certainly wouldn't have been able to turn what has been so painful to me into something where I can turn around and help others now going through the same thing, but helping them thrive right away without having to do what I did and not know where there's a resource. Actually becoming that resource is I just feel like I'm honored to be able to deliver something that wasn't there before. I think the biggest part is, being open. And what do I mean by that? It's like being open to the possibility of how you could heal in a different way. I think that traditionally and even your lawyer, even someone going through this is maybe going through therapy. I did the same thing, but because I eventually became open, I wasn't open in the beginning to be coached or have a life coach or any of that. I thought, oh, that might be woo-woo. That's not going to help me. Those kind of thoughts. But being open to different modalities can change your life. I mean, really, that's it. And that's one of the things that I learned through the process of, really trying to look at things from a different lens so that I could heal in a way that could serve, my kids, my family, my patients, and others. And so I think being open was something that I hugely learned that I was very closed-minded before. I mean, medicine, right? You're follow the books, follow standard of care, and that's what we do as medical professionals. But when it comes to your journey and what's happening to you being able to separate the facts of what's happening and then learning how to change the story is really powerful. And most physicians aren't trained to do that. We don't know how to do that. This is actually brain science. Yeah.
So what was it that was said to you or taught to you that turned this thinking around?
Yeah. So what happened is I hired a life coach and I started to really learn how to self-coach myself. And then I went through certification, honestly, just to heal myself, just to get really good at transforming the thoughts that I was having, the stories I was having into a version that I believed and that was sustainable for me. And And while going through certification, I just woke up one day saying, I have to share this with other physicians and healthcare workers, because if I don't, I felt very selfish about it, because I had just found peace of mind. I'd just been sleeping. I stopped worrying. I started to become so peaceful about if this case ended up where the patients, and it's not like a win or lose to me, but it's like if the patient gets the money, I'm okay with that. Because, I just started to be able to look at it from their lens too, and my own lens, and be able to change the story around that. And so I think, and one of the early on things that I would do for myself before I knew how to transform my thinking, I would do this. And this is sort of a self-compassion tool that I teach right away with people, because I think that it's so powerful, and we get caught up. And especially if you get served papers and that happens right in the middle of everything else going on in the office. And one of the things to do is, if you can get away, go away, get to a lone spot, take some deep breaths, and really go to, if a good friend of mine, a colleague of mine, if this was happening to them, what would I say to them right now? And say that to yourself.
Mm. That's really powerful and really great advice. For a million things, not just the big life events. I can work myself into a knot about nothing sometimes. All the time, pretty much every day. So
Right.
I can. So that's really great advice. And I'm so glad that worked for you, like to just look at it from a different perspective. I know certainly, I think litigation is just so feared among healthcare workers. There's a lot of talk about protect your ass and cover your ass and do this. And is this legal and isn't that legal? And we don't really always understand the reasons behind litigation and the processes surrounding it and what it's going to look like if it shows up. There's just so much fear. So when it does show up, it's just this big thing that you've been scared of your whole life, and it's just finally here on your doorstep without much understanding of why it's happening and how it's going to go and what your part in it is. And I think there's so much too, some of the research I've read on how physicians respond to malpractice is they really struggle with the loss of control. And maybe, I don't know if that's true of you or not. And nurses really get hit with fear, just huge fear of losing their job, their house, their colleagues, their marriage, everything, being on the front page of the paper. And my biggest, maybe I'm going to be really frank with you, my biggest perhaps foot in the mouth experience in my entire life so far was I was asked to speak on a panel regarding litigation and obstetrics with an obstetrician and a plaintiff lawyer and a defense lawyer and a physician and hospital defense lawyer. And I presented a little bit of that information. I said, doctors, when doctors are sued, they really fear the loss of control. And I made the smarmiest joke ever. I said, that's because they think they're God. And which was terrible. And I'm already sorry. I'm sorry, Dr. Laura, I'm even saying it to you. And I don't know why I did. It was just one of those things. And this guy turned to me on the podium and he said, "You bet we fear loss of control as the OB in any situation is the top dog. And you've got residents and students and nurses and midwives and medical students and nursing students working under you. You better, and maybe 15 patients and 40 more in your office, you better believe we got to have some kind of feeling of control of what's going on. Because at the end of the day, if any one of those people drops the ball, we're going to be the one who answers for it." And I was like, that is so right. That is so true. Mm-hmm. Yeah. And I am such a pain in the ass for saying what I did. But that schooled me, and I was really grateful for his response. But anyway, what I was going to say is that just going through the whole process of litigation and learning more about litigation stress and the legal process takes a lot of the fear away. Just like you said, to look at it as not a personal attack on you, but also there's a family who truly believes they've been injured and a lawyer representing them who truly believes that they have a case. There's so many sides of it. And once it's out of your hands, it's kind of out of your hands. The jury decides, the judge decides, the lawyers litigate, the expert witnesses bring their opinions forward. And sometimes the outcome is as it should be, and sometimes it isn't. And it maybe doesn't have much to do with what you did or didn't do. So,
yeah, and I think it's very complicated, certainly, for sure. And I think the thing is the loss of control, the anger. I mean, a lot of anger, I think initially is a big response in physicians, to then shame and fear and worried about their future and what the impact of the case would be. All of those things are what's called litigation stress, and 95% suffer from that. So it's almost every single person that gets slapped with a malpractice lawsuit is feeling litigation stress in some way or another. And there's actually a continuum. So there was a psychiatrist, Dr. Sarah Charles, that really started to do a lot of research and studying on the effects of physicians getting sued. And what happened through her studies is there's a continuum of litigation stress. And what happens is it can go into what's called medical malpractice stress syndrome, which is in the DSM. It is an actual diagnosis. It's a myriad of depression, anxiety, not functioning, like psychosocial issues now, and suicidal ideation. And so that is real, and it's an entity that needs to be talked about. It's something that none of us are really talking about. I don't know of anybody else outside of me, honestly. And I found you like that is really talking about these things that are real. And being silenced, I guess, in many ways in the profession.
Well, and I think a lot of people, and I don't know if you experience this, but a lot of healthcare professionals that I've spoken to that have gone through litigation or there've been a serious adverse event, they feel like they are abandoned by their peers even. It's like if you talk to them about this or you're even keeping friends with them, then, you're going to catch whatever it is that's going on. And so, sometimes the people who you would typically turn to for support are just not there for you because they're scared of the whole situation and you don't know exactly what you can and can't talk about. And I think maybe nurses do better. I'll just tell you a little experience that I have. Like nurses do maybe a better job, or it's not so hard for us to help each other and support each other. And we work in groups where in private practice would, you'd be the boss and sometimes it's lonely at the top, and you wouldn't have a group of like 90 nurses or 90 doctors that you work with all together at the same time on a unit or whatever the case is. But I can remember working in the hospital center, and when one of the OBs got really sick, they would come and lay down in the nurses' lounge because we'd take care of them. We'd get them a warm blanket and a hot cup of tea. And if they lay down in the doctor's lounge, they're just going to get stepped over and walked over, and they're not going to get the same TLC. So I think you guys in a specialty area of medicine have even a lonelier, harder time of it, I would think, than nurses do, in the respect that you don't have, or in my experience, don't have that same high level peer support that nurses sometimes give each other.
Yeah, we don't. I mean, isolation, I think, is one of the biggest things that happened to us. I mean, we're walking in the hallways in hospitals with other docs. They're going through the same thing. We're going through the same thing, but no one talks and no one knows about it. And that's one of the biggest things with my clients, Chris, is that they talk about wanting this support community, wanting to know that other physicians are going through the exact same thing they are going through, and being able to have that support, because it is difficult. It's difficult on your, not only just you and your practice, but your office staff, your home life, your children. You carry it everywhere that you go. It bleeds into all aspects of your life, and even your spouse. And, my spouse is non-medical. And so when he's a farmer, and so I would try to relay what was going on, but he didn't understand. And, he even went to the trial of mine for several days and didn't understand. And so it is a lonely thing, especially if you don't have a medical spouse, to talk to, I think. And this is where providing a resource for physicians where they can come and everything is confidential and everything is, a safe place. It's a safe place to come and talk and heal. And that's what it's meant for.
Well, that's awesome. We talked a little bit earlier how getting sued takes a lot of people or changes medical practice or healthcare professional practice. How did it change your own practice?
Yeah. So initially, I would say that I did play defensive medicine, what we call defensive medicine, whereas you order more tests, you obsess a little bit more. I would go home at night worrying about cases now, whereas I hadn't done that before, would be, just a little more over the top probably in terms of ordering tests and those kind of things initially. And then honestly, what I ended up doing is I ended up leaving private practice and doing more contractual independent consulting or independent sort of work where I would go help physicians in their practice instead of having my own. And I think that was a sort of a subconscious decision that I made because of this whole litigation stress that I was going through. But now, as I look back, it's one of the best decisions I ever made because it did free my mind up to being able to heal and learn how to heal. And now I, have this awesome schedule of being able to control, when I want to do OBGYN and I get to go and do that I feel like, and maybe because of the healing that I've done, I have so much less stress. I mean, I'll walk into the unit and the nurses be like, "You're so happy. Like, why can't you spread it on to the other docs?" And it's because I'm like, because I've done the work, and it's just medicine right now, especially with COVID and all the things that are going on right now with burnout and stress. A lot of physicians are feeling pressure. And gosh, medical malpractice lawsuit on top of that whole thing is people are leaving in droves. Is what's happening. Yeah.
And it's tough to do the personal work that needs done when you're so busy and stressed out and tired, right? It's a real challenge. Are there any parts of your private practice that you miss? Anything you've given up that you're like,
No, not really.
Okay.
You know why? Because what I've done is I've carved out, like I get to run labor and delivery, do all the GYN emergencies that walk in. And then I do a medical mission that I started a long time ago, where I go and do that twice a year and operate all week there. And so it's really been such a joy to be able to do those things now.
That's really good. I think that's some of those things are projects that people can't take on until after they retire. And that could, then you're just tired or tired, even tired than you're like, you're 65 or something. So good for you. Congratulations on all of that. It's great to see you happy. And it's interesting to hear that the people who work with you, the nurses who work with you, see that joy and happiness in what you're doing.
Mm-hmm.
That's really nice. I mean, I think that's proof positive that you've done your work and it's shining through. Where would you say you are on the journey, the continuum of getting back to you?
Yeah, well, I would say, and just to kind of, again, identify with the people out there maybe listening that might be going through something like this, like 5 years ago, no one would have said that about me. Like walking onto the labor and delivery floor, they wouldn't have said that you're so happy, and I just want to point that out, that it has been a journey and it has been painful and it has been obstacles after obstacle, but anybody that, if you learn the tools to be able to really manage your mind, manage your thoughts, help process emotions, which again, physicians don't know how to do any of this. We're actually the extreme beings of saying we're fine when we're not fine. And so, I mean, we learn to suppress emotions through our training. Like you can't feel, right? You can't cry when somebody's, that's kind of how we're trained. And so, it's almost like detraining yourself in a different way, in a better way. And there's a lot of work involved in that. But I think that, anybody that is going through something like litigation and it's still ongoing, I think that the best thing that could come out of, even if they listen to this, would be that it's okay to get help. This is where most of us think we can just get over it ourselves. And I'm here to say mine has been going on for 9 years. I could not get over it myself. I tried. I did everything. I tried just talking to my husband. I tried therapy. I tried all these things to get over it myself, and it did not work. And so having a peer support and having someone who's been through it, and actually even being able to just talk to that person, tell them your story, tell them how you're feeling, is healing in itself. To be in witness to someone that's been through it and has self-compassion for it. Sure. Is just one chat. Like, I will have people that I will just talk to one time, and that's all they need. And that's great, you know?
That's brilliant. That's brilliant. I think too, like, as you're talking, I'm just remembering a few things that, I've been through. And the first time, like, for instance, a stillbirth. And there's so much more than the actual event of that. It's the family, it's the tears, it's the smell, it's the feeling, it's how the baby looks and feels, and how the mother and father react, and who's in the room and who's not in the room. And it's, to be able to talk. The first time I actually spoke to someone about all those little details, it was the same for me. I could just let one of those things that had been bothering me for a lifetime just go. I just needed to say it to someone who understood. So I have no doubt that having you as a resource is really valuable. So let's move a little bit into your med-mal coaching. Let's talk more about that, because I think it's awesome what you're doing. Tell us a little bit more about your business, when it started, what you hope to accomplish, and how it's going so far.
Yeah. So, like I said, I woke up one day realizing I needed to just deliver this. And I started sharing just my journey and what was going on with me and how I've healed. And it sort of steamrolled into, I don't want to say, like, it's kind of like one of those things where when somebody comes out, like, it's almost like I say I came out, and I told people about my story, which I think some people were very uncomfortable with, me saying I got sued, right? I just started sharing I got sued, and oh my goodness, the, physicians coming to me saying, I got sued too. Like, how did you get help? Just that in itself has helped so many. And my hope is for this business. So I do one-on-one coaching. I'm actually in the midst of developing a group coaching program, but what is happening is, I want to normalize the conversation. I want it to be normal and recognized that you're going to get sued, and it's okay to be sued. And it's okay to tell your colleague that you got sued. Obviously, you're not going to talk about the details of the case, but you can talk about the emotions and what you're going through, and normalize the conversation. And honestly, I think this is just a stepping stone. And maybe I just have big visions and dreams about this, but really creating some med-mal reform in some way, shape, or form. I think it's needed. I think that there, especially in times like these today, I think that there is a need for balancing back fairness. Like, I'm not saying to take away the patient's rights or anything like that. What I mean is just coming together and finding a solution that is fair, that is just, that is, and taking away a lot of these cases that are end up getting dismissed. Because what happens is, really, I think statistics are 70% of cases get dismissed. And but there's money exchanged, lots of money exchanged before that happens. And litigation stress still happens because it takes such a long time to go away.
So how would you, let's go right there. If you had all the power in the world and all the financial resources in the world and no red tape, how would you reform med-mal litigation?
Yeah, such a good question. I think there's several different ways you can look at it. And I know lots of people have lots of opinions. And, one of the things that I really personally gravitate towards is having a standard of care board in your profession and being judged by that instead of being judged by people that don't understand medicine. I just think it's hard. I mean, my husband sat in my trial and he didn't understand any of the lingo going on. And he lived with an OBGYN who talked on call with an OBGYN, right? So it's like, if he didn't understand it, I can guess what happened with the jury, right? And so I believe we all practice good skin, like all of us go into this not meaning to do, I mean, it's do no harm. Like none of us are not doing anything maliciously to try to do something that harms someone, right? And we're delivering the best care that we have. And so to be judged in that way by a body of peers, I think makes way more sense than the way it's being done currently. But I know that there's opinion that some people don't think that that's a good idea, right? And some other people have proposed, which I do think might be a really good way, and this, you could probably comment a lot on this, is having fair experts. Because what I know and what I know with talking to other physicians and their trials and what has gone on with them is having good expert opinion based on good science,
right,
and being fair. And I don't think that happens right now.
I think, excuse me, I think you're probably right, or certainly you get very widely discordant opinions, pardon me, very widely discordant opinions. And I've done hundreds of cases and been to trial quite a few times. And I'm always, first of all, in awe, like you just described. You know, one time I spent my first 2.5 hours in court teaching a judge how to interpret a fetal monitor tracing, all the while thinking, it's taken me a lifetime to learn this. I can't teach it to you. I can't teach it to you in a manner that you could make an informed decision about this at the end of the day. And the other issue is, like, you know, the opinions, mine has been, I always felt, based, unbiased and dispassionate and based on standard of care, but there'd be a completely opposite opinion to mine. And how does a judge or jury, how in the world, you just hope you're the most credible person on the stand that day, because that's really all you got, because the information is night and day. And it's a challenge sometimes where, you know, a big part of my business is connecting expert witnesses with lawyers in both plaintiff and defense litigation. And it's a challenge, you know, keeping the experts on track and sometimes saying to the lawyers, like, we're going to give you an opinion based on the standard of care, period, whether it supports your case or not. And often they'll say, thanks, bye. That's the end of our time together. But it's a challenge keeping everybody on board with that, because, you know, understanding lawyers have a job to win their side of the case, to win the case. So it's something. So that's an interesting conversation that we could really, truly go on about forever, but we're going to kind of stay focused on something else. I do have, because you mentioned that one of the things would be to have a standard of care board judge whether or not the standard of care was met. And of course, then the issue of awarding damages is a completely different thing, and a completely different skill set, of course, you know, to figure out what's it going to cost to cover this person's expenses in care for a lifetime, especially a baby or child that ends up, you know, living 65, 70 years. How would you overcome, like, there's a lot of perception, I would have to say, that when a governing body investigates their own, that they're going to be very protective, that it's an old boys club or whatever you want to say, that you're not going to get a really fair, just, unbiased view or outcome. How would you overcome that? Or how would you propose we overcome that?
That's a great question. I think going back to, which I believe the definition right now is, did the physician reasonably follow the standard of care within the elements of science that we have? And I think, you know, maybe, and this was this was proposed actually by a physician group. One had said, perhaps each of us that are part of our board certification, each of us have to sit on this board at some point in time, so that it's an ever-changing board that have done the work, have done the CME, keeps up on their practice, does all those things. And there's an interchanging board to where there's an influx and outflux, and we all serve on it, and actually serve on it for free, perhaps, or like not get paid. Like the other thing I think is with these expert witnesses is the pay. And this is where biases, I think, can come into play. And I for one think, if it was more towards being fair, or everybody gets a set fee, perhaps we wouldn't have as much of biased opinion.
I see. Okay, that's interesting. I appreciate that you brought up reasonable standard of care, because I think that's something that can provide a lot of reassurance to healthcare professionals being sued. It's not a standard of perfection. It's a standard of reasonableness, and many things hopefully will be considered. And there are things that can be considered in your defense, even when there's a poor outcome. And everybody understands that sometimes there's bad outcomes. There's great care and bad outcomes. And on the flip side, there's sometimes terrible care and good outcomes by the grace of God, because I've been involved in cases like that where it's just like, oh, thank you, that turned out okay, in spite of all the problems and complications that happened. Yeah, totally. There's both flip sides. So what do you hope to accomplish? So when a physician comes to you and says, listen, Dr. Laura, I am struggling, I've been sued, what is your kind of attack and approach, and what do you hope to accomplish with them?
Well, I do an integrative sort of assessment. Everybody does tend to be in a little different place sometimes when they come see me. And I do that assessment. And then we really work towards getting them that peace of mind, getting them to sleep, getting them to not have the trigger. So when a trigger happens, perhaps they're getting an email or something in their offers triggers them to go back to the memory of getting served in this lawsuit that's happening to them, to work on that the pause in between the trigger and what starts to happen with their body sensations and their thoughts, and actually helping them learn the tools to be able to overcome that very quickly, so they can get back onto their intentional day and be that self-assured doc again, instead of going down the rabbit trail of negativity and negative self-image, doubt, shame, and all the things that play into it. And I've even worked with spouses of that significant other as well, to help them integrate better in the home, because what happens with these physicians, a lot of times, many of them want to quit their jobs right away, which the other thing is helping them preserve the love of medicine again and their purpose and why they did this in the first place, right? But also it bleeds into their home life and their family life, and the divorce rates are higher with these things. Relationship wise, on the other side of medicine, just doesn't go well. So a lot of times I'm integrating to help with both of them to get through this, so that the significant other can understand where they're coming from.
Sure. That's great. I just finished a book recently by Martha Beck, and it was on integrity. And
amazing
right?
book. I just read that too. Yes.
Oh, good. And the biggest thing I learned from that is when you get the crazy thought, which we all have about, I don't know, my mind is, I have crazy thoughts about all kinds of things all the time. Just stopping, taking that pause that you just described, and just stopping to ask yourself the question, are you sure that's true? Mm-hmm. Most of the time, my thoughts are not true. Like understanding that the things you're thinking are not necessarily true. And if you defend yourself the first time, you ask yourself a second time, are you really sure that's true? And that has just helped me tremendously on a couple of issues already so far. So I appreciate that you're teaching that pause and that moment. Is there anything that really caught your attention in that book?
Yeah, I just loved her book. I thought it was incredible. And yeah, I do follow her and what she teaches. I think one of the things that she does so well, which I consider myself, and maybe this was some of my healing, is she talks about a butterfly analogy, and when the caterpillar goes into the cocoon, it actually has these imago cells that dissolve. And so it's like liquid. And then for it to come out as a beautiful butterfly, it takes a lot of work, a lot of regeneration, a lot of healing in order for it to get out of that cocoon. And it takes forever sometimes. And the process of all of that is sort of can be the stages of healing. And many of us, I got stuck in the process of this cocoon where I couldn't get out and heal and fly and essentially become unleashed. Right. And so that's what coaching did for me, is it helped me release the chains that I had, that I felt like I was bound to. And a lot of it does, because you brought this up, Chris, before, a lot of it has to do with this perfectionism, the culture of perfectionism in our field of medicine. Yet I understand why it has developed, right? Because, we are dealing with human body. We want to be perfect. We want to do everything. But at the end of the day, most of us do everything, and we follow the reasonable standard of care, but there are still bad outcomes that occur that are not in our control, right? So I think that our culture of perfectionism plus our culture of not talking about these things really has perpetuated a big problem that has been ongoing for years now.
Sure. Absolutely. That's a great point to bring up. And I think the ability to be vulnerable, as a doctor and a nurse especially in an OB unit, I think you are the authoritative voice in the room. And for you to admit any level of vulnerability to anybody there is a tough thing. The issue of vulnerability and crying, like you said, crying is, and so often it's just so busy, when you've worked on a busy unit and you might have a terrible, terrible, terrible thing happen and have 5 minutes to have a quick pee and grab a half of a hospital cafeteria sandwich. Then you've got 2 more patients waiting for you and there is no downtime. And at the end of the day, you got a family and a husband and life responsibilities to go home to. So it's not easy. Well, yeah. I'm sure that now that you've gone through this experience, you must have some advice to offer on how to not get sued. Could you share that with us?
Yeah. So I love to kind of share how to avoid litigation with people. And I use the word avoid as like an acronym because I think that it's fairly powerful to kind of remember these are things. We brought up some of these things, but the first A in avoid is attitude, and really having a really good attitude and not an uncaring attitude. I think when communication is everything. And so the first 2 letters of avoid have to deal with communication, because honestly, that's the most reason why patients sue, is that they feel that they were not heard. They felt that you were not compassionate. They felt that you were in a rush and you didn't see them, right? Or hear them or know them. And building that relationship with the patient is so crucial. And the communication is so crucial. So your attitude has to be one of a caring provider, that you are hearing them. And what I like to do, so this is the V, which is value the patient's perspective. I like to go into a room trying to sit in the patient's shoes, especially if, say, something happened, like a complication happened, and an outcome happened that was unexpected, right? Or she had just had a miscarriage, right? And before I go into the room, I really like to sit and think, what is her perspective right now? What is she going through? And I walk in very compassionate and empathetic towards her perspective. And that goes so far, and even sitting there for a few more minutes, smiling, a handshake, those type of gestures, people see you as a human being and they value you. When you're in a rush, when you're looking at your computer screen and don't look up because we're now all in EMR, and, those things don't go well with people. And so it's just the little things that can add so much to the relationship. And I think communication obviously is key. That's the number one thing I think we could all do and learn from and get better at. The O is operate in systems. And what do I mean by that? Is having a system for everything in your office. The way that you do it is always the way you do it. And what I mean is, like, if you're answering a phone call, the nurses are answering phone calls, right? How are you documenting that? Is it the same way every time? Is it, are the messages getting to the physician? Like, what is your system in place that is streamlined? Because here's the thing, mess And if patients feel like your organization is messy or your office is messy, equals lawsuit. I mean, it's just more fuel to the fire that they're upset with you, that something can happen. So operating with systems that are consistent, that are, that you have in place with everything. And I mean, down to details of surgical, even like when you're scheduling surgeries or any of those pathways that you do in your office, you want to have a system. And then I is initiate self-care. So this is so important because physicians are workaholics, many of them. We work a lot more than, a lot of times we don't say no. And initiating your own self-care, having a day where you're off, you're spending time with family, you're learning how to be present, you're not on your phone, you're not answering calls. Like, this is so important. What it gets it for you in terms of your self-care. How can you cater to yourself so that you become more self-compassionate? If you're taking care of yourself, you're going to be able to take care of your patients so much better. And the D is document cleanly. And what I mean by that is, like, if you're taking phone calls, one phone call you document and then the other one you don't, and you don't have a template. Like, you just really want to keep it cohesive and very consistent, and documentation is really key. And now with EMR, yes, we have, I think maybe more, all-inclusive documentation, but at the same time, I'll make sure that you're reading it and that it's not just a template, and you're actually making medical decision-making, and you're writing out your medical decision-making in a way that if there's multiple diagnoses that you're thinking about, like, just write it all down in your thought process. Like, so I think that's a major key when it comes to litigation and trial, is your documentation is a big deal in the courtroom.
That's really such good advice, all 5 of those points. I had an opportunity to have lunch with a very experienced medical malpractice judge a few years ago, because they aren't all really experienced. Like, many trials I've been in, the judge is hearing a malpractice case for the first time in their career, and there's a tremendous amount of education. But anyway, I said to her, what are you looking for? Like, how the heck do you make a decision with all those opposing opinions and all that information? And she said, you know what, in the documentation, I really look for 3 things. Did the healthcare provider get what was going on? Did they understand that this particular patient was at a particular risk for a bad outcome? And then did they do everything they could to stop that bad outcome from happening? And I was like, damn, that's some good advice right there. Because you're right, the document cleanly. Sometimes I read pages and pages and pages of documentation, but not one word of it confirms that the standard of care was met. A lot of other things were done, but the standard of care and getting help and assistance and providing the interventions that were needed at that time were not done. So good advice on that. Is there anything else other than those 5 points? Do you have any other comments on avoiding litigation?
I think that those are the main points. I mean, I do love what you just said about, I remember even, with just in documentation in general, like, it is really important for us, especially as OB providers. Like, we have inductions for days, right? And we have things that go on, that patients are there for a very long period of time, that you are taking care of them and making sure that there's notes and that their thinking is there, not just nursing notes. And I think that's one of the traps that OBs fall into, is the nurses are doing notes, and we want to be doing notes as well.
Right. That's really good. So all that was great advice. And thank you so much for it. I'm sure all of the healthcare providers listening in, excuse me, I think everybody listening in will find that really valuable to hear. So we're still in the midst of COVID. We're recording this in February 2022, and it ain't over yet, as much as we all wish it was. Do you have any thoughts about how COVID is going to affect malpractice, and particularly obstetrical malpractice, but malpractice in general, in the weeks and months and years to come?
I do think that times like these, especially what's happening in the healthcare industry, a lot of people are deciding to leave medicine, physician-wise and nursing-wise, and really maybe having compassion right now to both sides would be helpful. And I don't know what the solution is. I mean, think about it. The first time a case came in to the ED of COVID, and no one had ever treated COVID. So we follow the standard of care based on our knowledge of what we've done in the past with other viruses. And some things work, some things didn't work, right? And to really understand that, again, physicians are doing the very best they can with what they're presented and with their knowledge that they have. I mean, technically, when that first came in, we were experimenting. We were doing the best we could, but we didn't know, right? To solely say we should have known is really hard to take. And so just maybe having that perspective, I think all of us need to step back and think about that. And now we have variants and we, all the things that are going on with us. And I think this is one of the reasons why physicians have left and nurses have left, because they don't have a handle on all of it. I just think back when someone is coming to the ED for the very first time and that case presents itself and we don't have all the stuff figured out, this needs to be taken into consideration when a legal process is going to be come into play, right?
Yeah, that's absolutely true. What was the standard of care at the time? And if there was no standard of care for that particular problem in place, it'll be interesting. Like, I never, ever want to wish a minute of my life away, but I sometimes think, I wish this was 5 years in the future, just to have that backwards perspective on, well, first, for this to be over, hopefully, and second, for to be able to take a backwards look at this and say what worked, what didn't work, what happened, what prospered, what failed, who survived, who didn't survive, and what did we learn from all this? Because there's no doubt it's been a huge life event for all of us. And I appreciate what you said. We kind of don't know. And it'll be interesting to see how this all turns out. Well, listen, we've been talking for almost an hour now, so we'll wrap this part of the podcast up. But before we go, I want to ask you a question that I ask everybody on the podcast. And because our listeners include lawyers and healthcare providers and the general public, I'd like you to answer this question for every one of those audiences. Let's start with healthcare providers. In your view, what is the most important thing that healthcare providers need to know about medical malpractice?
I think the most important thing is be open to exploring ways to get help for yourself and not think that, you can just get over it. Like, just be open to that knowledge. I think this is the biggest thing. If you got anything out of today, is to go get support, go get help right away, so that you weren't like me 6-7 years later, still dealing with litigation stress and not knowing how to overcome it.
Great advice there. What about lawyers? What is the most important thing you'd like lawyers and attorneys to know about medical malpractice from your perspective?
Yeah, from my perspective, I think handling physicians with a notion of a little bit of compassion, because we take this a little more personally than most other professionals out there, and to identify and know that litigation stress is real, and to help them right away, and maybe point them in a direction to where you should get support. Like, your spouse may not be enough. This is really important, and I do know that those, like, I am way better now than I was way back then. And if I would have been this way when I got deposed in my deposition, I think I would have been much better, overall.
Yeah.
Right.
Right. The whole process would have gone a little bit differently. Understood. And what would you like the public to know about malpractice?
I think the thing about public is I like you to look at both perspectives and both lenses, both viewpoints, because there's two stories here. And while I believe there are things that need compensated for, and patients do have valid complaints, and I'm not dismissing any of that, I want you to look through both lenses, because there's the other side to it too. And I think when we both look at each other as human beings that are doing the best we can on this earth at the time that we've been given, with the knowledge we've been given, maybe some of these cases wouldn't go so far, and maybe mediation would be better served and an option, and which doesn't really happen in this world right now. So it's just something to think about.
I think that's great, and very holistic and human and compassionate. And I hope there's someone who that means something to, everything that you just said. So thank you for your comments. Well, I think with that, we're going to wrap up this episode. If you'd like to connect with Dr. Laura and explore the possibility of one-on-one coaching or group coaching sessions, you can find her through her website, themedmalcoach.com. She's easy to find. There's several blog posts on her website, and there's a free publication there called Common Myths About Medical Malpractice. And I think this is really awesome news. Her coaching sessions qualify for CME credits. So check her out. If you're struggling in any way, reach out to get some help. I think we both know through our personal experiences and our research and our practices that there's no doubt this is a tough thing to go through, and you don't have to go through it alone. So thank you so much once again, Dr. Laura, for being here, for sharing your story, for your openness and your vulnerability on a subject that not a lot of people have spoken about so frankly. If you haven't already heard it, don't miss the shorter podcast by Dr. Laura, where she's going to talk about this, why she chose obstetrics as a profession, a little bit more about her personal life, what she does when she's not working, how she would talk to her younger self, and what advice she has to offer younger physicians. So don't miss it. Thank you so much for joining us. Take good care, and goodbye.